Good evening, all the aspirants present here. We'll be starting with the session. The topic is respiratory diseases, and the speaker that we have here is Dr. Vinod Jaiswal. So you may continue. Thank you.
Thank you. Hi, good evening, guys. Can you
Hello,
share
sir.
see my screen?
Yes, sir.
Okay. Can you see still? It's gone, right? Yes, you can see now, correct?
Yes, sir. We can see the question.
Okay, guys. Similar pattern. It's today topic is relatively easy, but it's a very big topic. Respiratory infections. Okay. So the pattern is similar like every time. Let's go ahead. So 60-year-old with COPD, community acquired pneumonia, is febrile, productive cough, chest X-ray showing consolidation, is not allergic to penicillin. So according to the UK guidelines, what is the empiric antibiotic of choice?
It will
Hello?
be oral clarithromycin.
Oral clarithromycin alone, right?
Yes, sir.
Okay. Anybody else want to attempt anything? Look at the question, guys. 68 elderly gentleman, productive cough, febrile, showing consolidation in the lung. And it's an inpatient empirical antibiotic for inpatient, admitted patient. Anyway, let's see the answer. Of course, oral clarithromycin is not the correct one. So it's IV augmentin or doxycycline. Typically, in common practice, you will see ceftriaxone plus doxy or azithromycin. So how do we explain this? Elderly patient with COPD, with consultation, with fever, with cough, admitted in ward. So you need to have oral antibiotic plus atypical cover, correct? So the NICE and BTS guideline also recommend Amox or Coamox plus atypical, either macrolide or doxy, depending on severity and comorbidities. Okay, particularly in older patients, IBMOX with Clarithrol or azithromycin is a good option. Uh, Understood, guys, this question?
In non-severe patient, why do we need two antibiotics to treat?
Okay. Why you think it is a non-severe patient? We don't have any severity here. They mention, yeah, they mention in the bracket non-severe, but it's a hospitalized patient, no?
Yes, sir.
68-year-old with cough and consolidation. You will treat this patient on outpatient basis or inpatient basis?
So generally, we see the CRUB criteria. If the patient is fulfilling any CRUB criteria, then we'll admit the patient. Or
Correct.
patient is having any signs of shock or mechanical ventilation need, then we will shift
Correct.
it to ICU. Otherwise, we will
Correct.
treat the patient on OPD basis only.
Okay. Uh, let's say they did not, let's say this a patient you include curve more than three. So then you will admit, right?
Curb में sir, if it is one or two, then we will admit.
Correct. And more than three?
Then we will admit in ICU.
HDU or ICU, correct?
Yes, sir. Yes, sir.
Yeah. So comes into criteria or no? Curve one or two? It comes, right?
Actually, there is just age because
Exactly.
age is more
Age is
than.
there, no?
And
Age is there. See, even the question is little tricky. If you select the option amongst oral clarithromycin alone, even you don't follow curve 65 or even you don't follow any other pneumonia severity index, patient with a COPD with consolidation in the lung, oral clarithromycin, how it will be alone? Tell me. It will cover only atypical, no? What is the most common organism?
Streptococcus generally.
Yeah.
Okay.
How clarithromycin will not cover strep.
Okay, sir. Okay, sir.
And plus, it's a COPD patient, so we don't know the history, but mostly he'll having repeated admissions also in the past, if such patient have. So again, this plain beta-lactam oral amoxi is also not enough. You need something intravenous, and beta-beta or beta-lactamase inhibitor like augmentin, which is the co-amoxiclav.
B.
Agree or no, guys?
Yes, sir. Okay, sir. So basically, in this, we don't know the what are the previous your previous. That's why we'll
Correct,
going
but
on it.
see, you have to select account the best amongst answer among the one. Correct. Even I would, if this patient, I will give again, not even augmentin will not be enough for this patient in clinical practice, but you have to go according to the guidelines for the UK and what they use. In general, patient will be requiring ceftriaxone plus azithro or clarithrol, or some people even give levo, which is not appropriate, but that's different. Anyway, not talk about clinical. We are here for MRCP, so we can talk about MRCP. The first option,
No. B.
yeah, sorry. Anybody want to say something?
No.
Okay, when you will use the third option?
So when there is a risk of pseudomonas infection.
Okay, okay. Anyway, there are some questions down the line. We'll discuss further more. So yeah, I think this is the correct answer. Chat, somebody has written something. Okay, B. So which is not the element of curve 65?
Sir, oxygen saturation less than 90%.
Yeah. Okay. So what is the fourth criteria?
Blood pressure.
What is the blood pressure?
Uh, 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 the systolic blood pressure should be more than 90.
Which
Less
is
than
not
90.
90 by
Sorry, less than 90. Less than 90.
90 by 60. Right. So you know, guys, curve 65, right? 1, 2, so 5 criteria
B.
up to any criteria positive, you admit the patient. More than 3 or equal to 3, you admit in HD or ICU, right? But even nowadays in clinical practice, curve 65, okay, it's a general guideline for ER people. Now we use for severity, we use PSI, which is pneumonia severity index. It's a lot of parameters in that. I think MRCP don't ask about any questions. Do you come across any questions about PSI, pneumonia severity index score?
No.
Hmm? You
No, sir.
do? No, no. So I think then leave it. If anybody come across the question, then look into the PSI score. This is a very crude curve 65. It has been going on since ages. So people are using it, you know. All right. So yeah, you guys already said to